Thank you very much at magandang araw mga kaibigan. Nagbabalik po ang inyong programang Aksyon Central Luzon Special Edition. Ito po si Sunny Lopez and today we feature the Britannia Medical Center. Alam niyo ngayon, pinag-uusapan natin yung tungkol sa kalusugan, no? Tungkol sa kagandahan. Sabi nila ngayon, pag meron kang pera at pangit ka, kasalanan mo na yon. Ang sabi nila ngayon, kailangan talagang kung gusto mong humaba ang buhay mo, you got to have constant check-ups at saka po yung medical healthcare, no? Kaya sila po ay na-invite natin dito po sa ating programa for this purpose so they can talk about the Britannia Medical Center. At I would like to introduce our special guest for today, ladies and gentlemen. To my left is the medical director, Dr. Erwin Brian Tan. Welcome.
Thank you.
And to the left of Dr. Tan, we have he handles the American Counseling Services. You know, he handles everything. Victor Torres.
Sunny, thank you.
You're looking good, huh?
Thank you, so are you.
Yeah. Okay, and to my right, ladies and gentlemen, is Cosmetic Department Nurse Jelly Ann Castro. What's this? What's this Britannia Medical Center, Dr. Tan?
Well, Britannia Medical Center is one of the newest addition to the healthcare groups of Angeles City. It caters mostly to outpatient medical services. Mostly, we handle cosmetics, cosmetic surgery, cosmetic medicine, cosmetic dentistry. We also handle medical services like the regular internal medicine, pediatrics, surgery, OB-GYN. And then we also have complete laboratories. We have x-rays. We have dental x-rays also.
So wellness to, no?
Yes, more on wellness.
Saka internal at saka external ang
yes.
Nyo. Kasi yung iba...
In and out.
In and out. Yung iba, pag magaling sila sa lahat ng internal organs sila, pero hindi magandang itsura nila. Hindi magandang pakiramdam, no? Okay.
Yeah.
So, yung si Charo, tungkol ka sa dental ka naman.
Yes.
So, malaking grupo to kung gano'n, no? Meron tayong tungkol sa dental at saka sa medical. Victor, this is now medical tourism, huh?
Yes, it really is. And on the counseling, the American counseling end of it, what we're doing is outpatient drug and alcohol treatment in line with RA 9165 and also family and marital counseling, general psychological counseling, drug and alcohol assessments, psychometric testing.
You have been doing this for a number of years now.
The drug and alcohol and the psychological, yes.
So because you know, we all know that if there's a problem with alcohol and addiction and everything, you can't look good, right?
True. Do you remember?
There's deterioration. Physical.
Do you remember 5-6 years ago, the very first time that I came onto your show, you did a drug and alcohol with George Gonzalez and myself. And but I've been doing this since 1989.
So tying up with the Britannia Medical Center, this is now a bigger group that you're working with.
Oh, absolutely, absolutely. It gives more exposure to the outpatient treatment program, and the population that we're targeting are like your workers here at Clark, okay, that say turn up positive on a random drug test. Then they would be able to go to our facility and enter the outpatient treatment program, but still continue to work.
Okay.
And it's more with people that have got a problem with either drugs or alcohol than the ones that are addicted to alcohol or to drugs. The ones that are addicted belong in an inpatient treatment center.
Okay.
But most of the people, if they're functional, where they can hold a job and still maintain a family, but are having trouble staying away from either the drugs or the alcohol, are the prime candidates for our outpatient treatment program.
Okay, so I'm gonna ask some more questions about that later on. I want to go back to Dr. Erwin Brian Tan, who is the medical director. Most of your patients are foreigners, right?
Around 70%.
Around 70% are foreigners, and you expect more to be coming in.
Yeah.
And you expect, as Mr. Nasangman said, foreigners visiting the country
Oh, yeah.
just for this purpose, going to Britannia Medical Center.
Yes.
So yun tinatanong ko kanina, yun yung medical tourism na to.
Yes.
Pero huli na tayo, di ba?
Well,
Compared to Thailand, di ba?
yeah. Although, when you take a look at it, the quality of healthcare in the Philippines is somewhat better in some areas
Yes.
of Asia.
Doctors are better.
Yes, doctors are better. Unlike in other countries where we have what we call see one, do one. Their training is they see one and then they do one, and then thinking that a patient would go to another country and then give their healthcare in the hands of someone else, and then they would expect 100% the perfect healthcare that they can get. I think what we have here is that we are fortunate enough to have a group of doctors that
Yes.
have the intellect, that have the skills, that have the training, and we just did it by
Plus the drive. So
yes.
you banded together
Yes.
for this. Are you the first of your kind in the group in the city of Angeles and Central Luzon?
I would say yes.
Pero sabi mo kanina, walang ano dyan, walang confinement. No?
Yes.
Ano na yung pinakamatagal na pag-stay ng pasyente dyan?
Less than 24 hours. We
Kung
can,
inayos mo yung ilong, ganyan. O inano mo yung
well, like for example, with rhinoplasty sa
Oo,
nose,
oo.
it's an outpatient surgical.
outpatient yan.
Outpatient,
Makakauwi na
yes.
kagad.
If the patient wants to be awake during the procedure, it's possible.
Pwede rin yan.
Yes.
So, o yung pampapayat naman, ganyan.
Well, like for example, liposuction.
Liposuction, yan.
It is actually considered also an outpatient,
Outpatient.
yes, service.
Outpatient din yan, ha?
Yes.
Okay. So, yung mga kababayan mo natin, at least, alam nila ho. This place that you have is located just very near Clark, di ba?
Oh, yes.
Nasa Enclave po yan, ha? Nasa Enclave, sa mansions.
Yes.
So, alam yung mansion.
Near the mansion.
Oo. Yung lugar nila doon, yung facilities ba natin kompleto for all the things that you talk about here, dito sa brochure nyo?
Yes. We try our best to make everything complete. We wanted it to be a one-stop shop for everyone.
Okay. So kayo naman, ano naman ang mga ginagawa nyo doon? Mga ikaw sa cosmetic ka?
Cosmetic. Basically sa cosmetic, we're doing facial,
Facial.
gentleman's facial, and diamond peel and RF. And we're helping doc also during the procedures.
Kayo pa rin inaalalay ng mga doktor when you're doing the procedures. So sa medical naman, ikaw, Miss Kimberly.
Sa medical naman po, yung mga gustong magpa-check-ups. yun po.
You do ACL, yung mga sa sports medicine, yung mga sira sa knees, ganyan.
Opo,
Ginagawa
may
niyo.
yung sports medicine po namin, may kapartner siyang PT, physical therapist for ano.
O yung nagre-rehab,
Yes.
ginagawa nyo rin yun.
Opo, meron din po
Procedure
kami.
na yun.
Yes.
So, bago lang to, di ba? Itong Britannia.
Yeah.
Bago lang. Ako napapansin ko lang kasi pag nagpupunta ako doon, sabi niya, TV daw siya. And I've seen the place. It's a good place, right? So, we've been talking about this since late last year. But because of the busy schedule of the holiday season, it's only now that I was able to accommodate you in my program. But after this, you'll be very, very busy. Your place will really be very, very busy.
Oh, yeah.
So, mostly, sa mga pasyente nyo, ano ba yung mga dumarating? Mas marami ba yung lalaki, babae, or good combination?
Combination.
Combination talaga. So, yung kababaihan ngayon, di na lang solo yung pampaganda, no? Gusto rin na lalaki yan, gwapo. Okay. So, okay. We'll have a short break, ladies and gentlemen. And after the break, we'll be discussing yung pong halos lahat ng ino-offer nila, starting with cosmetic surgery, yung cosmetic and implant dentistry, no? Tapos, marami pa ho. Meron pa nga tungkol sa andropause, no?
Yes.
Oh, marami pa. Pati ngayon sa yung kay Victor, no? Marami po silang ino-offer dito. Pag-uusapan po natin yan.